Dogs have 3 eyelids, and the third one is an extra one that sweeps back and forth across the eye surface. Anong function yan? It provides protection and it spreads the tear film. Known as the nictitating membrane, the third eyelid is usually not visible. Cherry eye in dogs is often called third eyelid gland prolapse. The tear film in a dog's eye is produced by the lacrimal gland and the third eyelid gland or the nictitans gland. The latter produces around 60% of the tear film, which means that it plays a highly important part in keeping the surface of the eye wet. When the eye's surface becomes dry, the eye is uncomfortable and also becomes susceptible to developing corneal ulcerations, conjunctivitis, as well as unusual types of discharges. In this video, we will look at how cherry eye affects the eye, its causes, symptoms, diagnosis, treatment, and prevention. How does cherry eye affect the eye? Yung prolapse gland doesn't produce any tears any longer when it is in the incorrect position kasi nga nag-prolapse na siya eh. This means that the surface of the eye becomes dry. Even though the condition isn't typically painful, it can cause minor irritation, increases discharge from the affected eye, as well as conjunctivitis, yung pamamaga sa paligid ng mata. Third eyelid gland prolapse can affect both eyes, but that doesn't mean that this necessarily happens at the same time. The second eye usually becomes affected around several weeks after the first one. While eye infections normally require a scrape or a cut to develop, cherry eye doesn't. It has nothing to do with the way you keep your doggy's eyes clean. Wala kang kinalaman doon. The condition occurs when the third eyelid is connected to the rest of the eye's anatomical structures by ligaments that are weak. Ibig sabihin mahina yung ligaments na nagko-connect doon sa third eyelid na yon. The prolapse happens when they break. So since it is a sensitive gland that's not usually exposed to the outside environment, it can easily be attacked by bacteria or specks of dust that are present in the air. This can lead to an infected third eyelid. Causes, ano bang dahilan ng cherry eye or prolapse of the third eyelid gland? Cherry eye is typically seen in dogs that are between the ages of 6 weeks to 2 years old. It's quite likely that you, as the pet parent, have done nothing wrong if your dog has developed this condition. Wala kang ginawang masama. If a dog is born with the weak ligaments, we've already mentioned, he or she is likely to get cherry eye. There is also a genetic predisposition involved as well, since some of the breeds that are most likely to develop cherry eye are Shar-Peis, Beagles, Newfoundland, Bulldogs, Cocker Spaniels, Pekingese, Miniature Poodles, Neapolitan Mastiffs, Bloodhounds, Shih Tzus, and others. Ito yung mga common. Believe it or not, it can even be seen in some cat breeds, such as the Burmese or the Persian, yung mga pango. Ano ba yung mga symptoms nito? The most easy to spot and obvious clinical sign of a prolapse gland of the third eyelid is the appearance of a cherry-like formation in the lower corner of the dog's eye. Dito yan sa medial canthus of the eye. The gland pops out and is red, so it can be rather easy to spot even if you're not a specialist. Additional symptoms include dryness and redness in the affected eye. Tear production can be halted or significantly reduced, which means that the eye can become very dry. A dog with cherry eye can rub and paw its affected eye, squint, or have a hard time seeing as well as in the past. Swelling is also very common. How do we diagnose this? A consultation at the vet's office will typically lead to the correct diagnosis. In this case, if you've noticed any of the clinical symptoms that we have mentioned a while ago, take your dog to the veterinarian. It is often a good idea to choose a veterinarian who is experienced in treating this condition, as the diagnosis will be more in-depth and the elected treatment will be chosen correctly. Treatment. Treatment of the condition is done under local and general anesthesia so that the gland can be pushed back into its place. There are vets that will choose to remove the gland in its entirety, but it is not recommended. Huwag kayong papayag. In fact, removing the gland can affect tear production, and most dogs that have their gland removed are at a high risk in developing a condition known as dry eye or keratoconjunctivitis sicca or KCS later on. If surgery is selected, usually only a part of the gland outer cover is removed. The gland itself is tucked inside the third eyelid and tucked into place. Dogs that have their cherry eye corrected using this method have a good chance of recovering without any complications. Unfortunately, there is a 5 to 20% chance that the gland slips out of place again. This depends on the amount of time it was already out, how swollen it was, the type of surgical procedure that was performed, as well as the condition of the cartilage in the third eyelid. Prompt medical treatment is required to prevent recurrence. After surgery, the dog will require post-operative medication that can include eye drops or eye ointments for 1 to 2 weeks, as well as tablets or painkillers and antibiotics for several days. With this particular type of surgery, stitch material is absorbable, so there is no need for you to remove it afterwards. Prevention. There's no way of actively preventing this medical condition from happening. It runs in the family, so it is a good idea to avoid breeding dogs that had the condition when they were young. However, we would like to note that paying attention to your dog's eyes is recommended, especially if you're the owner of one of the breeds that are most predisposed to this medical issue. Weak treatment is extremely helpful. Again, this has been your vet, Dr. Stresho. I hope you learned something today. And if you would like to suggest any topics or you have comments, please use the comment section below and let's talk about it. I hope you learned something today. See you again next week.